Hi everyone, I'm a Professor Son. I'm gonna introduce you anti-cancer therapy trends and basic education. Don't worry, it's so simple, very easy. And after the class, I will give you some quizzes and Q&A time. If you have a good answer and question, I will give you the best prize, A, B, C, or D. Maybe you will be the winner. You got a mark. You know, my lecture contains 3 parts. First, background. I'm gonna explain the kinds of immune cell. That is a basic information. Second, I will explain the history of anti-cancer therapy and then explain immunocancer therapy in detail. This is the main topic. Lastly, I'm gonna tell you the future of the anti-cancer therapy. Third, summary. It's important to summarize today's topic. You know, the best way is a good ending. Finally, we will have Q&A time. If you have good questions and answers, I will give you the best prize. Look forward to being a good student. You're not gonna watch a video clip about immune cell.
The immune system, one of the most complex parts of the human body. An intricate network of cells and molecules evolved over the course of hundreds of thousands of years to protect us from the dangers of the outside environment. So how does it work? First, detect the threat, summon help, and launch a counterattack. When a virus infiltrates a cell, for example a cell lining our airway, the cell detects this as foreign and produces cytokines, messenger proteins, to summon help via phagocytes, a type of white blood cell, and also help to contain the local spread of the virus from cell to cell, typically the role of interferons. Specialized white blood cells called phagocytes try to destroy the intruding virus by literally eating them up. These first responders show up within minutes and make up the innate immune system. It is fast to respond, but not precise, and it does its best to shut down an infection as soon as possible. The adaptive immune system is highly specialized, but much slower. Dendritic cells collect small fragments of the virus left over from the battles of the innate immune system and ferry these to our lymph nodes, where highly specialized white blood cells called T cells are waiting. T cells are pre-programmed soldiers, each one trained to target a specific invader. When a dendritic cell carrying a specific type of virus fragment shows up, the relevant T cell will divide many times to produce an army of clones. There are 2 main types of T cells. Cytotoxic T cells recognize and destroy infected cells that harbor the virus, and helper T cells boost the immune response by activating B cells to produce antibodies. Antibodies are specific proteins that block the structures that viruses use to latch onto and enter our cells. Antibodies also mop up the viruses that are floating around within our bodies. Although T cells and B cells can take several days to move into action, they are incredibly precise. And they remember. After the virus has been neutralized and the army stands down, most specific T cells and B cells die off. But a small fraction stay alert, patrolling the bloodstream and lymph nodes for repeat attacks. If the same virus attacks our cells again, these memory cells spring into action, activating the power of the adaptive immune system without the days-long startup. This memory is the basis of how a childhood infection or a vaccination can lead to lifelong protection.
Due to damage, foreign pathogens invade our body. First of all, like macrophage or dendritic cell, phagocytes contact them, and then phagocytes interact with T cells each other. And T cells also interact B cells. Finally, B cells release antibodies. You know, T cell is the main key of immunity. We just focus on T cell. I'm going to explain the history of anti-tumor therapy. You know that cancer therapy is using chemical compounds, aka chemotherapy and radiation therapy, traditional surgery. However, they are not specific. They can attack our whole body, not only cancer cell, but also normal cell. So researchers and scientists developed antibody cancer drug, aka tumor-specific antibody or targeted antibody. That's why we are now available for antibody engineering technology. And scientists focus on human immune system. Early scientists thought cancer had nothing to do with immunity. However, some scientists thought if you control immune cells, they can attack cancer cells easily. Our immune cells, particularly T cells, cannot attack our cancer cells because they recognize the cells themselves. Immuno-oncology therapy can be separated into immune checkpoint inhibitor and immune cell therapy. The difference between them is that one is an antibody drug and the other uses a cell. From now, I'm going to explain about immune checkpoint inhibitors for more detail. You know, there are many immune cells in your body. T cell, B cell, macrophage, dendritic cell, NK cell. Today, we only focus on T cell. Like this, T cells interact with tumor cells through these receptor and ligand. This role is to recognize the cells themselves. If there are not interaction, T cells attack the cancer cells. So some scientists developed a blocking antibody drug for CTLA-4. At the moment, it was so sensational. The ability of killing tumor cells was so strong. However, there were serious side effects like autoimmune disease. So they developed the other antibody drugs for PD-1, PD-L1, reduce the side effect, increase the survival rate from 20% to 40%. And I'd like to show you the survival rate. According to this figure, there will be a difference in survival rate 2 years later. Immuno-oncology therapies twice as much as chemotherapy. 20%, 40%. And this is the survival rate of stage 4 lung cancer patients using PD-1 and PD-L1. Maximum 40%. This is literally a significant data. Next, I'm going to explain about immune cell therapy. This therapy is based on patient-derived T cell. After we isolate only T cells from the patient's blood, we perform gene modification of T cells. The reason why we were able to do this was because of the development of gene manipulation related technologies, such as CRISPR. And we cultivate only those cells in large quantities and inject them back into the patient. During this step, we also needed to have large-scale culture system and contamination prevention technique. Next, this is a good case using CAR T-cell. At only 6 years old, Emily Whitehead was facing a life-threatening recurrence of acute lymphoblastic leukemia, the most common childhood cancer. Emily's cancer resisted over 16 months of chemotherapy treatments when her parents were told that her cancer had relapsed and she would not survive. Determined to save their child's life, her parents enrolled their daughter in a clinical trial of a new immunotherapy treatment designed to turn Emily's immune system into a powerful weapon against cancer. The treatment, called CAR T-cell therapy, had never been tested in a child before. The treatment worked, and Emily's cancer went into complete remission immediately and celebrates 8 years cancer-free. What is the future of anti-cancer therapy? I'm sure that therapy will be developed by our scientists. Like influenza virus vaccines, we also make cancer vaccines. If you get the vaccines, we can prevent getting cancer. To be honest, it's not easy to develop the technique currently. However, that is our mission and destiny. I'm going to summarize today's topic. First, currently, immunity is the key for anti-tumor therapy. Second, you know there are not perfect therapies and drugs. The scientists keep on increasing the survival rate. That is a forever challenge. Third, scientists are starting in various fields. Sometimes they fail, sometimes they succeed, sometimes they got a good insight. Lastly, as I said, we need to understand anti-cancer therapy and drugs for us. What kinds of therapy and drug? What is their limitation? What is their side effect? I know we have no choice but to rely on the doctor. However, at least we need to understand the therapy and drugs because that's our own body. this is Q&A time. Do you have any questions?